according to a policy statement published today in Stroke by the American Stroke Association, a division of the American Heart Association. Improved stroke care systems are needed to ensure that scientific advances in the treatment and care of stroke patients improve their outcomes. Date May 20th, 2019. Source: American Heart Association Summary for Scientific Advances and Innovations in Stroke Care to translate into better outcomes for patients. Comprehensive stroke care systems must be in place to provide optimal care. The new recommendations support guidelines that standardize stroke care, reduce barriers to emergency stroke care, ensure that stroke patients receive timely care in appropriate hospitals, and improve access to resources for secondary prevention, rehabilitation, and recovery after stroke. Federal and state policies guidelines should be issued to standardize the organization of stroke care, reduce barriers to emergency stroke care, ensure that stroke patients receive timely care in appropriate hospitals, and facilitate access to secondary stroke prevention, rehabilitation, and recovery resources. Optimized stroke care systems, from primary prevention through rehabilitation and rehabilitation, help provide patients, caregivers, and service providers with the necessary tools for prevention, treatment, and rehabilitation. In response, the Declaration recommends that health professionals and physicians offer public education programs focused on stroke systems and the need for emergency care by calling 911 in response to stroke symptoms. New recommendations for stroke systems to improve patient outcomes. Science Daily. We have seen tremendous progress in acute care over the past 14 years, and our concept of a comprehensive stroke system has evolved from there, said Dr. Opeolu Adeo, chairman of the Emergency Opinion Writing Group and associate professor of emergency medicine and neurosurgery at the University of Cincinnati. New recommendations for stroke care systems to improve patient outcomes. 2014, the use of telecommunications to connect stroke specialists with stroke patients in rural areas has improved and maintained stroke care. According to new research, education stroke care systems should support local and regional public education initiatives to increase public awareness of stroke symptoms, especially among vulnerable populations. Rehabilitation and supportive stroke treatment systems should provide comprehensive follow-up care, including continuing primary care and specialized stroke treatment services such as physical, occupational, speech, and other therapies at discharge. Recommendations for establishing stroke care systems. Update 2019. A policy statement of the American Stroke Association.